Good evening, everybody. My name is Celine, and I'm a co-founder of Lafiya. And with Lafiya, we bring modern contraceptives to women who want them and need them, no matter where they live. I was also here last year, so if you recognize me, hi. I'm quite excited to tell you a little bit about the growth that we've experienced in the last year and some milestones that we've hit. But I wanted to start off with a personal story. I became a mom last year to my daughter, Evelyn. And to be very honest with you, I was really scared of giving birth. Even though I knew that living in the Netherlands, I would have access to world-class healthcare and doctors and nurses who would do everything they could to keep me and my baby alive and well. And we did make it alive and well. She's now 1.5. She's walking. I take her to the petting zoo. But not everybody has those chances. And I want to introduce you to my peer, Fatima, in Nigeria. She's 28. She already has 7 children. And she is tired of giving birth year after year. She's also scared of getting pregnant again because her last birth nearly killed her. She was bleeding excessively, and without any nearby medical support, she thought she wasn't going to make it. She knows a next pregnancy can be fatal. When she had only 3 children, she already wanted to take a break. She had convinced her husband she wanted to try out family planning. So he had given her money to take the motorbike for an hour and go to the clinic. But when she arrived at that clinic, there was no health worker who could help her or give her services. And there was no stock of any contraceptive methods for the last 4 months. And so she had to return home without any family planning. And now she has 7 children. This is the reality across northern Nigeria. The most proven and effective family planning methods are not reaching the women they were designed for. In fact, 1 in 4 women in Africa wants to use family planning but doesn't have access. That's 70 million women without a choice. We see a surge of maternal deaths. There's a woman dying during pregnancy or delivery every 2 minutes. And 1/3 of these maternal deaths happen in Nigeria. That is not a statistic, that is a crisis. But there's a solution to this crisis, and it's called Sayana, a tiny injectable that lasts for 3 months. It gives agency to the woman because she can self-inject. It's only 85 cents, and it's specifically designed for low-resource settings like northern Nigeria. It's discreet, no one can see you're using it. You don't have to transport it in a cold chain, and it's tiny, so a health worker can carry many of them to remote settings. So why is it not reaching the women that it was designed for? There are 3 reasons. The first one is there's no effective supply chain to bring it to these remote communities, so it doesn't reach the clinics. And in the cases where it does reach the clinics, there is no trained health worker to give the services to women. So if these women show up, they don't know what method is right for their needs. That's where we come in. We work in 3 steps. Let me show you the approach. Step 1 is the right product. We import Sayana Press from its only manufacturer in the world, Pfizer, and we bring it first to Nigeria and then to the remote communities. And we do that with the right people. We train government-employed health workers. We give them a 3-day training on family planning, the services, the counseling, so they can give high-quality care to women in their communities. The Lafiya sisters work where they live, so they have high trust from the women around them, and they know which communities need the care. And then lastly, they do it with the right approach. So our mobile app enables the Lafiya sisters to give personalized, high-quality counseling so women know what's right for them. And if women want to use Sayana, they can get it for free, so that any woman can get high-quality counseling and services for free. So let me show you what that looks like in practice. Oh. Can we click it here?
Sunana Wasira Sale Suleiman, kuma ina aiki da ƙungiyar Samun Lafiya a Bichi Local Government Malkawa Garu DSC. Na tashi bayan na yi sallah asuba, bayan kuma na karya an yi shirya yara sun tafi makaranta, ni ma zan shirya, sannan zan ɗauko jakata, zan zuba allura ta Sayana da PT da BP, sai kuma na ɗauki jakata na tafi asibiti. Zan je kuma na yi aiki a rana. Sai kuma idan na house to house ne, shi kuma idan na shirya na ɗauki jakata, zan shiga gidaje, ko kuma idan wani lokacin bayan na shirya mata sukan tarar da ni gida in yi musu, ko kafin na shiga asibiti, ko in sun riga ni zuwa asibiti, daga asibiti za a turo musu tun da bani da nisa da asibiti. To ko da yaushe har zuwa dare kullum ana turo min mata cikin gida in yi musu allura, ko yau da safe akwai wacce na yi wa kafin na gama shiri ma. To alhamdulillah na gama aiki lafiya, na dawo gida lafiya, duk da na gaji amma ina farin ciki, ina murna saboda na samu nasara a aikin, na je inda ya kamata, kuma an samu matan da suke karɓar wannan allura ta tazara haihuwa, sannan kuma sanadiyar haka an samu rage-ragen mutuwan mata da ƙananan yara. Na gode sosai, Allah saka da alkhairi.
Thanks. So in the last few years, we've scaled quite drastically. And let's take a look how that's working out. Let's look at our reach first. So as you can see on the left-hand side, in 2023, we distributed around 10,000 doses, which we were extremely proud of at the time, by the way. But now we've scaled that. And by the end of this year, we're on track to reach 800,000 doses and distribute these to 400,000 women who can now access contraceptives. And why does that matter? So we've seen that in Fatima's area, the contraceptive use was only 2% when we started. Less than a year later, this has grown to 56%. So more than half of the women in those communities were using family planning services. Now, why does that matter? We have very rigorous evidence that using family planning continuously can cut maternal deaths by 44%. And let's look at our cost too. Right now, our programmatic cost for 1 year of contraceptive coverage is around $5. We've had an external cost effectiveness analysis made that shows that we can save a mother's life for less than $3,000. So that's why we do it. Now we're looking to scale this approach across Nigeria. We're collaborating with the government to make these services available across all communities that need it. And we're making good steps to getting there. The government is already acting as the doer at scale, and they're taking the lead on training new health workers. They're paying the health workers, and they're doing supervision of the counseling quality of these workers. That's really important because at scale, we want them to be the ones who are leading it. The government is the one who has the permanence and the mandate to really roll out these health services across the entire country and make it available for everybody. They're also including Lafiya's data in their projection for next year, how much family planning products they should buy. And that's important because it helps prevent stockouts in the long run. So imagine, previously, none of this community-based work in the villages were ever included in the projections. So permanently, they were just in this vicious cycle of not ordering enough product. We're also at an inflection point with the government of them becoming our payer at scale. In the end, we want the government to be responsible for sustainable health financing. And we're getting there. We just had a big win earlier this year, where one of the state governments committed to cost sharing for commodity procurement, which means they're also going to put money on the table for buying family planning products. and that helps stretch every philanthropic dollar even further. Next year, we're planning to distribute 1.2 million doses of family planning products and scale to 2 additional states in Nigeria. The dream we're building towards is one where every woman has the access and the tools she needs to determine her own future in her own time, on her own terms. That's 70 million women getting their future back with Sayana in their hands. Just imagine what they can do with it. Thank you.